Welcome to the Honest Health Podcast with your host, Jeffrey Burke. Honest Health brings you the brightest minds in the natural products industry, as well as athletes and entertainers. Jeff will keep you entertained and informed while educating on how to be successful on your healthy journeys. Now, here's your host, Jeffrey Burke.
Hello and welcome back to the Honest Health Podcast. My name is Jeffrey Burke. I'm your host and I am so happy you're here today. If it's your first time here, thank you for showing up. Maybe one of your friends brought you or mentioned the podcast. If you're back again, welcome back. I'm so glad you're here. A lot of you have been listening to me for a long time. Being on the air for over 40 years, I had a lot of listeners all over the country. And then when streaming came in, all over the world. You know, today this new platform is exciting. It's fun. It allows you to listen when it's convenient for you. And if you're telling your friends about it, tell them to go to drjeffreyburke.com. Once they're there, they can click on the icon for Spotify. They can also go to YouTube and actually watch what you're seeing right now. I think it's going to be really nice. I'm going to have an array of really great information and some of the best minds and the best guests and the best people in the know that you can possibly imagine here on my show. Today, we're going to be talking about a topic that I think is very important, and it's a topic that has changed in status over the years. And the topic is chiropractic health. And I think a lot of people have changed their viewpoint on chiropractic. I've been a fan of chiropractic medicine since the 80s and the early 90s, but a lot of people back then thought of it differently. My guest today is not only a chiropractor, but an amazing friend of mine, Dr. Nancy Fallon. She is a local chiropractor here in Las Vegas, Nevada. Her company is called Fallon Chiropractic. I've been there many times. I've sent a lot of people there as well because of the trust that is there and because of the high level of high quality treatment. Dr. Fallon earned her doctorate in chiropractic from Palmer College of Chiropractic in Davenport, Iowa in 1987. This year in 2024, she's celebrating her 27th year at Fallon Chiropractic here in Las Vegas, also celebrating her 37th anniversary as a chiropractic physician. Interesting story. When she was young, she loved gymnastics. Tumbling and balance beam, uneven parallel bars, all that good stuff. But after one competition, she suffered severe neck pain. So her father took her to the chiropractor, Dr. Ronald Nikolic. After that adjustment, not only was her neck pain-free, but she could see better and hear better, was more flexible, even colors to her seemed brighter. She told her father immediately, "That's what I want to be, a chiropractor." And before you know it, here she is all these years later. It's her passion and her life. Every day she looks forward to helping everyone who comes into the practice. She loves to help people discover how much better life is with a spine that's properly aligned. If you go to her office, I guarantee you won't feel like a number. Maybe number one, because when you're there, you're a top priority and they've got your back. For Dr. Fallon, chiropractic isn't just her profession. It's her passion. Help me welcome my guest today. Hey, Dr. Fallon.
Dr. Burke, so great to see you again after all this time.
Oh, it's wonderful. You know, we've had a history of her working on me. We've been friends for a long time. She was actually at my awards ceremony when I was inducted in the Nevada Broadcasting Hall of Fame. She's worked on many of my friends, many of my professional friends, athlete friends. And it's just really great to be able to have some place that you could recommend and trust. So my question starts today, and I had a couple of friends ask some questions. They said, you know, when you first started in the field, was it kind of an uphill battle? Because you were also fighting maybe chiropractic stereotypes at that time?
You know, if it wasn't for the passion that I had, I think I may have decided to quit because it was a big struggle. Anytime you open your own practice and you start from scratch, in my case, it was an empty building that I had, this had to plan which room was going to be which, and then starting with staff. And then getting well known and getting your name out there, along with the insurance struggles. Yes, it was a struggle. It has really changed. And oh my gosh, 27, 28 years later now, I couldn't be happier or busier.
You know, and that's wonderful, you know, and word of mouth does spread on both sides of the fence, good and bad. You know, if I go to a doctor that I like where I get great service, I go to see you. I mean, I want to recommend people to go there because, you know, we want them to feel as good as we do. So that's important, because if you're letting your fingers do the walking through the yellow pages, if you will, if we still had those, now it'd be through the Google pages. But I think people are guessing a lot with where they go. And if they pick somebody that doesn't really make a difference, sometimes it closes their mind to an entire field rather than just saying, okay, that wasn't a good choice, I'll try someone else. And I hate to see that, because they could be missing out on something that could make a dramatic difference. I mean, I remember at the very beginning, I would go to the chiropractor and it was just a snap and a crack. I loved it. Most people at that point didn't, but boy, has it changed. It's amazing when you go to your office now and you see all that is offered to a patient that comes to see you.
Right. It's incredible. We now even have a laser scanner that scans the feet, from the feet all the way up the body, to actually make measurements and look at weight balance from left to right and posture. And honestly, that is a huge, huge change in the field, to be able to look at biomechanics, because all these years, if we're looking at posture, we're looking at alignment. If it's starting in the feet and we're realigning the body, obviously you're never going to fix something unless you fix what starts in the feet. And you only know that by measuring. So I have to get you a copy of our newest scan. By the way, we do scan people for free. It's complimentary. They can come in, take the shoes off, stand on the scanner, and we print out a report. And we can see the balance from left to right. You can see the difference in arch from left to right, and whether someone is pronated or supinated, or difference in arch height. It's amazing. So it's helped us be more successful in getting rid of pain, sometimes instantly, in a matter of seconds, putting orthotics that are custom made to that person in their shoes.
Well, I think what happens is, and I think we're all guilty of this. I think we all have discomfort and pain in our body sometime, once in a while, or on an ongoing basis. And I think a lot of us, although we are looking for a resolution to that, a lot of times, more than none, we end up just accepting it, dealing with it, and using anything we can, both pharmaceutically and over the counter, to kind of cover it up so we can get through the day. And we just kind of end up existing and kind of gliding through. And it's amazing. I know people that are in this kind of realm, and I send them to see you. And they come out and they're just like, they're mad at themselves because they waited so long. And I said, coulda, shoulda, woulda, it doesn't matter. Nothing matters from the past. It only matters today and moving forward. You went, you saw a difference, you're feeling a difference, you're making a difference. So
Right.
It's amazing, if we sometimes prioritize ourselves and our health, we're going to find that we're going to see results that are noticeable. Now, we're impatient. Don't get me wrong. We are a very impatient nation. Everybody wants to lose 50 pounds by Friday, and they want years and years of problems to be resolved. And obviously that doesn't happen. But the interesting thing is, I've gone to see you before when I have had a 3 or 4 day migraine, and I have a history of migraines, and I have walked out of your office with that migraine gone. Now, if you've never lived through that and the amazing transformation that makes, it's incredible. So I'm a big believer. I'm a big believer in chiropractic. I'm a big believer in you and your clinic, because you have so proven yourself to me.
Thank you. And it's a shame people feel like they have to suffer with headaches. For example, I've had patients who've had headaches forever and just been told they have to live with it, even getting Botox for headaches, and that not even working. That sometimes 3 or 4 sessions and the headache is gone. I mean, not temporarily, but gone for good. It's one of the symptoms that can really be helped with taking pressure off the nervous system through chiropractic adjusting. So I'm glad you're able to get that out there to people too, because that's one of the worst things in the world, to suffer with a headache. It affects you and everybody else around you.
I was sitting in the airport a couple of weeks ago, and we had a little bit of a delay, and I was just sitting in the corner. I read everything I brought with me, and I didn't want to use all my battery. I wanted to save that for the plane. So I was just sitting there watching people, and as I looked around, I saw people just rubbing their temples, and people cracking their necks, and people just doing head rolls and trying to adjust themselves in the chair. And I thought to myself, like, 80% of these people are either out of alignment or in pain of some kind or another. Structurally, there's something going on. And I wonder how many of them have actually done something about it and how many have just accepted it. But I mean, it's not just older individuals like myself and people that are in my age bracket now. I'm talking younger people that are experiencing this as well. So it's something that's almost epidemic that's out there because pain and inflammation are rearing their ugly head every single day. And I think people that take a risk, for them it's a risk to go see a chiropractor the first time. They're going to be so pleasantly surprised when they actually feel good again.
And they are. It's amazing. And to be honest, it's so rewarding when someone doesn't know what you do and they come to you and they realize, they look and say, what the heck did you do? To be able to explain to them the connection between the brain, the spinal cord, the nerves, and the function and the sensations in the body is a very rewarding thing to do. And oftentimes it is on the first session that they will feel a big difference. But you're right. The longer they suffer, the more it takes to actually reverse that and make improvement.
Well, I think the thing is, today nothing is all the same. Like all supplements are not created equally. All herbal products are not the same. A lot of them are higher quality. Some of them are put together better formulations, better delivery systems. And it's the same in the medical arena. All chiropractors are not the same. I remember the very first time I went to see you. And we had kind of known each other. You had come to my stores and we got to know each other. But we sat there and did a extremely detailed interview. And I was thinking the whole time, boy, there's a lot of questions for, coming, because I was used to going to places where like, hi, your name's what? Snap, snap. Thank you for coming. And they never interviewed. They never asked questions. And I learned very quickly how those answers to those questions was painting you a picture to be able to deal with me and my long list of craziness to deal with. And that was something that reeled me in the very first time.
Right. And people aren't used to that because they're seeing doctors that are treating them through an HMO where they have a minute to get through from A to Z, and they don't ask questions. So for me, I realized if you take the time to ask questions and go through all those things, sometimes you'll hear something that you never would have discovered had you been in and out of the room for 1 minute. And the easy way would be in and out, here you are, Jack, and go ahead and crack your back. But the problem is you're not getting to the bottom of it. You're not getting to the cause. And if you can't get to the cause, then you're obviously not able to fix what's going on.
Okay. No, I agree with that. How does massage fit into your philosophy in your clinic?
So in my clinic, I actually have 5 massage therapists that are certified, trained, licensed in the state of Nevada. And they work with me, with my clients, to help relax the muscles and rebalance the muscles and break up scar tissue, adhesions, trigger points, things like that. So that when I go in as a chiropractor, I'm able to access the spine a little easier, deeper, and have a longer lasting realignment, a more effective realignment. So I'm a huge fan of massage therapy. In fact, we also use heat and a roller bed. So if someone's not getting massage first, we like to have them go on the roller bed. And most people love that. It's relaxing.
I love that.
And comfortable. And it stimulates movement of lymphatic fluids, relaxation of muscles. It's just one of those great things to do for your overall health.
Well, I noticed today with so many people working from home and people in home offices, so many people, their posture's terrible, and they're slouching, and they're putting all this strain on their neck and their shoulders, and it goes all the way down their arms to their fingers and their lower back. They're not really investing in chairs that make a difference, because chairs do make a difference. They're probably not getting up and stretching and doing the things they need to do during the day. But we're seeing a lot more people that are working from home in home offices, or people that are at their desks all day with lower back, middle back, upper back, shoulders, wrist, carpal tunnel, elbows, pinched nerves, numbness. And that's not slowing down. That's increasing.
No, and it seems like so much of it is related to using the cell phone, looking down at the phone, and kids are doing that as they're growing up with cell phones, developing poor postural habits and crooked spines. But I want to say that I think the world's been conditioned to ignore pain, but your pain is the way your body communicates with you. So if you're having numbness, tingling, it's your body's way of saying, hello, do something about this. Whatever it is you do something, don't let it go. Because we see this pattern of pain. If it isn't resolved, it often becomes numbness, tingling, weakness. And then we see muscles atrophy where nerves are compressing the motor function to the muscle. So the muscle is atrophying. Once they've progressed that to that state, there is nothing that we can do to reverse that. It's like stepping on a garden hose and expecting the plants to be watered. Those nerve pathways.
Some interesting questions that some of my friends gave me to ask you, and I know they're questions that a lot of people will ask. The first one is, when you go to the chiropractor, when you get to the point that you're getting and have received relief, however many visits that is, do you stop or do you continue maybe doing tune-ups? I mean, I'm sure people come in for body tune-ups.
Right. Well, in my practice, we are treating floor layers and painters, which is exactly what it sounds like. They're on the floor doing flooring, kicking flooring, laying carpet, painting, reaching up to ceilings, painting and taping and that kind of thing. They tend to need supportive care more than other people, but we always recommend after a series of sessions to break the cycle of pain, maintaining it. Now, how would you maintain that? Maybe it would take every 6 weeks. It could be that it's once a week. It depends on the profession. It depends on the condition. But just like if you're brushing your teeth and you're getting a good result brushing your teeth, you don't just stop brushing your teeth.
Right.
Or working out or taking vitamins and that kind of thing.
Okay, that's a great answer. Second question is, what is the earliest that you can go to a chiropractor? Because I think a lot of people think, well, they're young, they haven't fully developed yet, need to be a full-size adult, they need to be already in pain. I think the preventive side is also important, but how about age?
So there are chiropractors that treat babies and even chiropractors who treat newborn babies. I don't in my practice, but there are very, very light techniques that use the finger pressure of testing the ripeness of a tomato that are used on infants. That is a different specialty than my practice. In my practice, we might see someone as young as 4 years old. If they're upright, walking, ambulating, we can look at posture, we can look at the spine. The most important years of all are the development of the spine. For women, by the time they're around 21, their spines fully ossify or turn to bone. For men, it's around 24. So if the spine is twisted or curved or out of alignment during those years, when they go through puberty and their bones are ossified, those patterns tend to be then permanent. So those formative years are very important. And but once they have actually formed those patterns, we can go in and try to recorrect things and straighten things out. But I am a fan of preventative care, checking things. Are they moving right? Are they, is the posture normal? That kind of thing.
I was having a conversation with two of my friends, and one is a at-home worker that's behind the screen and the computer 8 to 10 hours a day. The other one is a cement worker and works on houses and as a contractor. And they were arguing back and forth, having a discussion about chiropractic. And they're like, well, you don't need it. You sit around all day long. He goes, I'm busy physically working. And I said, you both need it. How would you answer that?
Well, I would say if you have a spine, that's who we're looking for, someone with a spine, because the spine houses the nervous system. And if the nervous system is not functioning normally, you're going to have alterations. You can have alterations in not only how you feel, but actually how you function too.
Here's a question for you. Being a chiropractor, putting your energy and your strength into what you do, Do you get chiropractic support yourself?
Oh, absolutely. Yesterday, in fact, I I've been working with another female chiropractor here in town. We're working on each other. We do trades. But yes, I make sure that I get my alignment checked. I also use my own treatments in my office. I just did a neck traction session on myself this morning too.
What's the machine that I love to talk about? It's I call it the rack, but it's actually where it actually kind of almost stretches the spine. It seems like, and all the moistening agents get back in between all the vertebrae, and I call it the rack.
Yeah, I love that. So it can be called different things, but the three machines that I have are called decompression traction. One is a DTS machine by Chattanooga, and the
Mhm.
others are the KDT tables, Kennedy decompression table. And basically, they traction or stretch either the neck or the low back. And with the neck, you're laying on your back at an angle and you're strapped in. You totally have control to shut it off if you don't like it. Though most people say, oh, it feels like exactly what I need. I mean, it's opening up nerve channels, blood flow channels from your neck to your brain. And it's for things such as numbness and tingling in the arms, herniated discs, chronic neck pain, headaches related to the neck. And then we also traction low back, which we can do either face down or face up. And basically, through a series of 8 to 10 pull and relax cycles, it decompresses and it causes a change in the hydrostatic pressure between the vertebra. And like you said, the fluids can rush in. And it actually untraps herniations through a series of pull and relax. In my office, I have some films, MRI films, on my view box right near me that show in 6 weeks we had a 24 millimeter huge herniated disc in the low back that 6 weeks later, with just traction, was gone on the follow-up MRI. So it's very effective for pain, but it's also effective to try to fix herniations, bulging discs, and pressure on the spine from those discs.
Now, chiropractic has changed as far as what you can do as far as testing and stuff like that. You now, and have, I think, for a while now, you can send people for MRIs and things like that.
Oh, absolutely.
Yeah.
We can send for blood work, CAT scans, PET scans, ultrasounds, MRIs, x-rays. And what I do is send someone where they can walk right in, have x-rays done. Then we log in on the computer and look together on my big digital screen, and a radiologist reviews the reports. But I have access to those crazy almost the same day. Whereas
Wow.
sometimes if you see a primary doctor, you're waiting 2 weeks to go back to see him. And so they've really made it nice for us as physicians. If you care and you want to, you can create an account and log in and see those results right away.
I love it. What about athletes?
Well, recently I was just telling a couple patients this last week that athletes have chiropractors on staff, football players, hockey players. They have chiropractors and they have massage therapists. They know how important their body is to keep it functioning normally and well so they can perform. And so I always tell them, if an athlete deserves it, you do too. Use chiropractic as part of your wellness plan to keep your body functioning, aligned, and moving well.
I remember I had sent someone to you many, many years ago, and she was, I think, in her late 70s. And, her friends told her, oh, you can't go, you're too old. You can't go, they won't be able to work with you because, your age. And she had come to see you, and you made such a dramatic difference. Are you seeing people on the later year spectrum?
Oh, absolutely. And I have to tell you a funny story. I had a woman who was 84 who had been somewhere else for a year being adjusted, 84 years old. And it was through Medicare, Medicare covers manipulation. And she went to this chiropractor. I don't know how they could get her to go for a year without getting better. But she came to me and we used traction on her. And by her 12th session, she was just so happy, full of smiles. And she said, I can't believe it. She said, I'm hanging curtains again. She had
Wow.
no more back pain after 12 traction sessions. And so, even at that age, if you do the right treatment, especially with traction. It's very effective if that's the cause of the pain, to use a series of tractions to reverse. So traction is a very effective and safe treatment, especially if you've been everywhere else, done everything else, and it's not hard to try. And normally by the fourth session, you're going to know if that's the answer.
I was flipping through the channels one night, and I was in my studio and I had the TV on. I was just in the background, and somehow I landed on this channel, and it was somebody who had won a lottery. And they're asking all these questions. Are you going to buy a big house? Are you going to buy big cars and travel all over the world? And the guy says, the only thing I'm going to do is have a weekly chiropractor adjustment, a weekly massage, get new orthopedic inserts for my shoes, and do everything that I can do to be more flexible and not in pain. He goes, that's where my winnings are going. And I thought that was really cool.
Oh my gosh, that's wonderful. Yeah. And it sounds like he had his priorities right, for sure. And then take off to Bali.
Yeah, exactly. But I think what happens is we don't know how to prioritize. We're so busy, we're chasing the deadlines, and we're just trying to get done. Most people, they work a 5-day work week, and then the first day they're off, they're just trying to decompress because they're so stressed out. Most companies are short-staffed after the pandemic. Emotional and mental health is in the toilet. People did not take care of themselves during the pandemic, and they're dealing with the ramifications now. People are not in a good mental place. Depression and anxiety are everywhere. Our bodies are totally out of sync and out of shape. And so you have that, let's say that 5-day a week, and it's Saturday, all day Saturday, you're just like a pile of goo because you're decompressing and just trying to get through the day. And then you have that one day left that you can get yourself ready. And then about 3/4 of the day, you start stressing out because you got to start all over again the next day. So we really don't take the time to decompress. We don't make personal time. And even though in our mind we're thinking, I'm going to go home, going to change my clothes, go for a walk, go to the gym, we get at home, we sit in that couch where our rear end fits into that dent in the couch, and our arm is on the remote and the other hand's on our phone, and we're in. And we're not going anywhere because it's become comfortable, and we know better. And if we would just work a little harder to get started, we could see some results that would make us want to stay with it. But we're not taking care of ourselves.
Right. We're going at 110% and then slamming the brakes on and doing nothing. Yeah, it is so important to come up with a plan. And stress is just, it's a way. I tell my patients, you figure out a way to deal with it. What's it going to be? Deep breathing, relaxation, meditation, hot bath, prayer, step out in nature, chiropractic, massage also. Those are important to pick and put something into your schedule. And myself included. You asked if I get care. Absolutely. As someone who works with people with pain, I have to. Because you're also touching people and you're absorbing their energy, and you're dealing with their different moods. When they're in pain, they're not feeling well. So you have to have a plan to come down, take the time, and rejuvenate.
We are both people that love what we do, and it's very rare, because most of my circle and the people that I know, they may like what they do, but they don't love what they do. Most people my age now are retiring, and here I am starting another new venture and loving what I do and traveling. I travel extensively, like 3 weeks a month, and I'm meeting with groups and traveling and teaching and educating. And I love what I do. You love what you do. Your passion comes through, and that wonderful passion, just comes through you right into the patients. And, they get to feel all that wonderful passion, which helps them in their recovery as well. Because you couldn't do and be as busy as we both are and not like what we do. We would have crashed and burned a long time ago.
Well, what do you do for stress, Dr. Burke? What do you do to rejuvenate?
I go to the gym. I walk. I meditate. I love nothing better than a hot bath with lavender oil listening to music. I love it. I love hot showers. I love jacuzzis and hot tubs. I have my horses. The dogs, of course. Horses are very grounding, and to me, people can say it's weird, but I can hug one of my horses and I can feel the energy all the way down to my feet. And when I get home, I mean, to me, that's grounding. And I get to do things that I love. I announce a lot of Western events, just because people ask me to. And of course, I'm going to. I do a lot of benefit events. I do a lot of benefit lectures. Um, that's how I relax. I mean, if I'm sitting in my studio and I'm working and I'm writing and I'm working on an article and I've got 5 French bulldogs underneath my feet while I'm working in here, that to me is my decompression time. People might say, well, you're working. I'm like, no, I'm not. This isn't work to me.
Right. And you have your 5 bulldogs and I have my 3 cats under my feet.
Yeah, I got them, and I got the 2 border collies, and then of course all the horses too. So
that's wonderful.
There's plenty of those. So that's another whole story. So another question. This is another one that just came in recently. It says, how does diet and drinking water and hydrating help your chiropractic effects work more effectively? Good question.
Well, obviously, if you're dehydrated, your body is not going to function the way it should, right? But also, soft tissues have a percentage of hydration that's necessary for the body to heal and recover. One of the things we find too when we do massage therapy is it releases toxins out of the bloodstream, out of the fat cells, which we all have. And so the water helps remove those toxins out of the body. So, how people feel when they're dehydrated, or when they're dehydrated, they can have headaches, they can have symptoms that mimic other things, and they think, what the heck is wrong? Especially being in the desert, hydration in general is important. But if someone is dehydrated and they've come in for a treatment here, they're not going to respond as well as if they are nicely hydrated, with or without massage.
Agreed. I think also we have to remember that, life is a process. And, we have kind of changed our focus and we think more about our jobs and our careers, which is great. That's all good, but it seems like we have a lot more obstacles in our way and we're sitting way back on this back burner, with all the intent of taking care of ourselves. And I think it is just kind of a prioritizing. Sometimes you just have to learn how to say no to some things and just feel good about that and say yes to the things that are going to make you better. Because if I'm better and I'm more relaxed and I'm more rested and I'm more focused, I'm going to be better at whatever I do. But if I'm exhausted and I am running in circles and chasing myself and have run myself down and not feeling good, I'm not going to be any good to anybody, including myself.
Right. Taking that time for yourself is important. And people have all these excuses, but the truth is, if they want to make the time for it, if they make that decision that they're a priority, they come to a point where they will find a way to fit it in the schedule. But sometimes they wait until they're slammed up against the wall and they're in crisis when they come in. And it's their body's way of saying, hey, this is not working. You need to stop.
Well, I love this. I hope you'll come back and see me again. Thank you for this today. This has been so much fun. And I want people to know how absolutely incredible you are. Fallon Chiropractic here in Las Vegas, Dr. Nancy Fallon. Nancy, leave us with a thought for the day. Something, it could be on any topic you like, just a thought coming from you.
So what I want to say is that I think more than ever, it's important for us to take care of ourselves and to listen to your body. Whatever you're doing, listen to your body. And consider chiropractic as a way to feel better, move better, and be happier because of it.
Oh, I love that. That's beautiful. My thank you to Dr. Nancy Fallon for being here today. Thank you for all of you for taking the time to tune in. Remember, send your friends. Send your not friends. Send them all, because we want everybody to feel good. Send them all to my webpage, drjeffreyburke.com. They can click on the Honest Health icon. It'll take them to Spotify. They can click on the YouTube icon. It'll take them to be able to watch the video that we're having and that we're doing on every show. Make sure that this is new to me. I've been doing radio for a long time. So with podcasting, if you're going to go there and it says, click this, subscribe to this, or check this, do it all. I don't know what goes to what, but I want to have you there. I want to have you on a regular basis. I want to be able to bring you these amazing guests so that you can make changes in your world. I hope you guys have a wonderful day. Take care of yourself, and
Thanks,
God
Dr.
bless.
Burke. You're amazing.
Thank you.
Stay tuned for more information from the Honest Health Podcast with Jeffrey Burke. And make sure to check back often for interviews and conversations from the guests we all want to hear from. I'm John the Announcer. Thanks for listening.